Everyone, my name I am B. Coleman, and as most of you know, I am a layperson who has studied natural medicine on my own for just over 23 years now. And today we are discussing tonsillitis. So let's dig in. And before we start, just make sure that when you are not speaking, that your microphone is off. The first protocol that I'm going to cover was posted by Dr. Ikram in the BP users group in February 23. I have not used it, and it goes as follows. Streptococcinum, Streptococcinum, Streptococcinum CM, a single dose. Starting the next day, you will use two remedies together, and that is Ferrum Phos 30C, Calimure 30C. Those are mixed equally and taken 3 times a day. The next one is actually there's 4 remedies, but they're 4 individual protocols that I got off of an article by Christina Villacorte. You may be familiar with her. She is a homeopath, and she is often online. So the first remedy is Belladonna 200C. Again, this is for tonsillitis. Belladonna 200C every 2 to 3 hours for a couple of days to decrease inflammation. I would say continue taking it until you muscle test negative. The next one is Merck Cyn, CYN, 200C, together with Belladonna 3C, and this is every 3 waking hours. And it is one of the best for pus-infected tonsils. The third one is Lycopodium 30C. I thought that one was kind of an odd one, but Lycopodium 30C for conditions that are better by having warm drinks. And when the pain usually starts on the right side, or maybe is worse on the right side. No frequency was given, but 30Cs are generally taken 3 times a day. Lachesis 30C. This one is used when pain usually starts on the left side and may spread to the right side. Again, no frequency was given, and again, 30Cs do tend to be taken 3 times a day. The next protocol is by Joette Calabrese, which I assume is a Banerjee protocol. And it is for both tonsillitis or strep throat. And the best way to make sure that all the infection is gone is to muscle test. Once you muscle test negative for this remedy consistently, you can stop the protocol. Excuse me. I am particularly fond of this one. It is Heparsulf 200C twice a day. Now, when the situation is acute, whether it's strep, whether it's just a sore throat, whether it's tonsillitis, I will dose every 1 to 3 waking hours. And then once it's no longer quite as acute, then I will go start going further and further apart until I'm back at twice a day, until it is resolved. Now, in the alternative, if there's a bad taste in your mouth or sores in your mouth when you have the tonsillitis or strep, or if saliva is copious, then you take Merck Cyn 200C twice a day. And Joette says, if pain is severe, add a dose of Belladonna 6C or 3C every 1 to 3 hours as needed. However, for throat pain, I tend to prefer Belladonna 30C every 30 minutes for the pain as needed. There's only one more, and this is, I have a list of Requig, I don't know if that's how you pronounce it, Requig drops, and this is R1, so it's their first one on their list, and it's called inflammation drops. You can buy this remedy online, or if you have a remedy maker, the rate is 644,237. They did not indicate a recommended potency, so I would start on the low end and maybe work up to a mega potency, or maybe make a combination of both potencies. It is for a multitude of uses, a lot of inflammation issues, but among them is tonsillitis, and in particular, chronic tonsillitis, or even just enlarged. I know sometimes people have enlarged tonsils, and they say that there's no infection. I'm not sure what that stems from, maybe allergic reactions, I'm not sure. But this is good for both tonsillitis and enlarged tonsils from other causes. And that is everything that I have. If there are any questions, let me know. And otherwise, I will hand it over to Dr. Imran. Dr. Imran, you may proceed.
Thank you very much. Bismillahirrahmanirrahim. Good afternoon, everyone. Here is Dr. Imran from Pakistan. Today we talk about a topic, tonsillitis. So today I share some homeopathic remedies which we are common use in our clinical practice in tonsillitis, and some protocols. So first I talk about what is the cause of tonsillitis. First one is viral infection. Tonsillitis mainly arises from viral infection like influenza virus, responsible for causing common cold and sore throat. Second one is bacterial infection. Tonsillitis may also be the result of bacterial infection. The most common bacteria that cause tonsillitis is group A beta hemolytic infection of tonsils, which this bacteria is strep infection of tonsils. With this bacteria is properly caught strep throat that leads to inflammation and pain in the throat and tonsils. Strep throat is highly spread quickly from one person to another through cough, touch, or sneeze. It is very common in school going children and among teenagers. Major complication may arise to strep throat infection if not treated properly well in time. These include rheumatic fever, inflammatory condition affecting joint, heart, nervous system, and skin and post and kidney inflammation. Bacteria other than this, however, can also cause tonsillitis. For example, pneumonia, mycoplasma. So, what is the sign and symptoms of tonsillitis? The main sign and symptoms include red swollen tonsils along with pain in throat, which is the first indicating feather of tonsillitis. The mane usually gets rose while swelling. The pain may be one-sided or appear on both sides depending upon which tonsil is involved. The other symptoms that may attend are difficult swelling, fever, bad fitted breath, headache, scratchy voice, ear pain, and neck pain, while yellow pus spots may also appear on the tonsils. The glands in the neck may be swollen and tender. In chronic cases, tonsil stones may form. In young kids, excessive drawing of saliva, increased fuzziness, vomiting, low appetite, and stomach pain can be observed. So, how many type of tonsils? First, acute tonsillitis. Acute tonsillitis. In this type, the symptoms remain from 3 to 4 days, but in some cases may linger for 2 days. In some cases, acute tonsillitis may progress to follicular tonsillitis, in which the cryptus tube-like investigation from the surface epithelium of tonsils get filled with berbice and pus. It presents as yellow or white spots at the opening of the on the tonsils, which gives follicular appearance. In case of chronic follicular tonsillitis, the corpus gets filled with infected cheesy matter. Second one is chronic tonsillitis. A person suffers from acute tonsillitis multiple times in years, short periods of time. Recurrent tonsillitis, the symptoms la- last for longer time, more than 2 weeks. Risk factor throughout tonsillitis can affect anyone, but certain factors increase the risk. First, young age. Tonsillitis is more common among young children. Very young children are at high risk of tonsillitis from viral infection, and those between 5 years to 15 years are prone to get tonsillitis from bacterial infection. However, tonsillitis can at any age throughout chances are less as compared to children. The reason in the immune function of tonsils decline after puberty, which may be the reason for reduced chances of tonsillitis in adults. Second, germ exposure. Excessive germ exposure in children puts them at risk of tonsillitis. Children remain in close contact with same age group kids in school, parks, playways that expose them more to virus, bacteria that cause tonsillitis. So now I want to share some homeopathic remedies which we common use in our clinical practice. First remedy is belladonna. First remedy is belladonna. Belladonna for acute tonsillitis with red swollen painful tonsils. Belladonna is the top recommended medicine for treating acute tonsillitis. The key indication for its use in red swollen enlarged tonsils with marked pain. The pain is rose while swelling, mainly liquids, and through throat remain dry. Fever with intense heat in the body accompanies the above symptoms. Heat, tightening, and lump in the throat may also be felt. So we are use belladonna in 30C, belladonna in 200C, and belladonna 1 ml according to the patient condition. So second remedy is Merxol. Second remedy is Merxol for pain in tonsils extending to ears. Merxol is an extremely effective remedy for treating tonsillitis with pain in tonsils extending to ears, especially pain in tonsils extending to ears, especially when swallowing. The nature of pain is mainly stitching type. On examination of the throat, the tonsils look dark red and ulcer or white spots on tonsils can be present. Excessive salivation is also observed. Foul odor from the mouth is present. So we are use Merxol in 30C, Merxol in 200C, and Merxol in 1 ml according to the patient condition. Third remedy is Hepersulf. Third remedy is Hepersulf. Hepersulf for infected tonsils and coins. Hepersul proves very successful in treating infected tonsils with pus points on tonsils, also known as particular abscess in which pus behind the tonsils. The symptoms to look out of using it are stitching pain in the throat and pain from throat radiating to the ear. There is intense pain while talking or swallowing, sensation of lump or splinter or sharp piece of glass or wood stuck in the throat in is felt. The person may hawk up yellow mucus. So we are use Hepersulf successfully in our clinical practice. Hepersulf 6C, Hepersulf in 12C, Hepersulf in 30C, and Hepersulf in 200C according to the patient condition. So fourth remedy is Calcarea carb. Fourth remedy is Calcarea carb. Calcarea carb is an excellent remedy for treating recurrent tonsillitis after recover from acute tonsillitis phase. This remedy can be used as an treatment for some chronic disease that is hindering cure of some other element or treat tendency to have recurrent tonsillitis. An indicative symptoms for use of Calcarea carb is the tendency to catch cold frequently. Even slight exposure to cold air affect the throat and tonsils in cases needing this remedy. Calcarea carb is mainly suggested to treat tendency to have recurrent tonsillitis. It will help to build immunity to fight with throat infection naturally. It can be used in 30C and 200C and 1 m according to the patient condition. So fifth remedy is Suranium.
Would you repeat that one?
So fifth remedy is Suranium. To treat tendency to recurrent infected tonsillitis, Suranium is very effective is boosting immunity to prevent recurrent infected tonsillitis. Tonsillitis with pus points on tonsils, pus accumulation behind tonsils. These medicines reduce susceptibility to recurrent throat infections. Those needing it have markedly swollen tonsils, pain with swelling and thick mucus in the throat. Along with this, there is foul smelling, salivation, and hawking of fizzy mucus bites. Having bad smell and taste, there is recurrent pus formation behind the tonsils. It can be used in person who suffer from infected tonsillitis repeatedly. Use of this medicine with will build immunity to prevent recurrence of such infections. Uranium is mainly used in 200C and 1 m according to the patient condition. So sixth remedy is Merck Iodatus rubor.
Would you spell that one, please?
Merck Iodatus for left-sided tonsillitis. This remedy is majority indicated medicine for treating left-sided tonsillitis. Indication for its use are swollen tonsils with dark red fosse area between cavity of mouth and pharynx on the left side, sensation of lump in the throat and disposition to hawk. We are use this remedy in 30C and 200C according to the patient condition. So seventh remedy is Merck ioditis flavus for right-sided tonsillitis. This remedy is further pointing towards its use or swollen tonsils on the right side, sticky mucus in throat, and constant inclination to swallow. Other symptoms that may arise are the feeling of lump in the throat with the relief sitting in by taking cold liquid. So we are use this remedy in 30C and 200C according to the patient condition. Now I want to share some protocol which we are use in our clinical practice. So my first protocol is Belladonna 30C, Bacteria 30C, and Betacarb 30C. Mix together these three remedies and take 3 times a day.
What was the third one again?
Belladonna 30C, Bacteria 30C, and Betacarb 30C. Mix together these three remedies and use 3 times a day. Okay, second protocol is double AB, Econite 200C, Arnica 200C, and Belladonna 200C. Mix together these three remedies and use 3 times a day. So third protocol is if tonsils swell, throat pain, and also fever, then we are use Salacia 6X, Ferrum Fast, 6X, Calcarea Floor 6X, and Kali Mayor 6X. Mix together and use every half hour one dose. So next protocol is throat pain and enlarged tonsils and also cough.
Jimmy Somerville, The Temptations gearbeitet. Sie war in
Barbara?
TV- und Kinoproduktionen tätig als Synchronsprecherin und hat
Barbara,
gearbeitet.
please turn off your mic. Barbara, please
Oh,
turn
sorry.
off your mic. Thank you.
Okay, so next protocol is throat pain and enlarged tonsils and also with cough. Causticum 200C, Belladonna 200C, and Britacar 200C. Mix together these three remedies and use 3 times a day. So if anyone have a question about this topic, so I'm here to answer. If anyone want to ask a question, please turn on your mic.
Dr. Imran, oftentimes I see posts where people are saying that they have chronic enlarged tonsils, sometimes adenoids too, but that they are not infected. Do these remedies work in that situation, or do those require other remedies, other protocols?
So if only enlarged tonsils, then I start protocol with Sulfalinum 1 m 1 dose and Belladonna 30C, Bacteria 30C, and Bretacar 30C. So Sulfalinum 1 m every Sunday 1 dose, and other 3 remedies 3 times a day.
Would you repeat the 3 remedies, please?
Belladonna 30C, Bacteria 30C, and Bretacar 30C.
Thank you. I do see a lot of those posts. Do you know if they are not infected? Are those being caused by allergic reactions, maybe?
Yes, it's a chance.
Okay, great. Thank you.
Welcome.
So that last one was Belladonna 30C, Baptisia 30C, and what was the third one?
Bretacar 30C.
Thank you.
Welcome.
And those are taken equally, you said? They're mixed
Yes.
equally?
Yeah, mixed together.
Great, thank you.
Anyone have a question?
Thank you, Dr. Imran, so much for this wonderful webinar on tonsillitis today. This is such a great one.
Welcome. So So, Ava, do you want to talk today about tonsillitis?
Sure. Thank you so much.
Yes,
Okay,
yes, please.
amazing. So this is such a common uh, issue that is, I think, universal anywhere. Our tonsils are the first stop, if you will, in our immune system, in our innate immune system. When something comes in, it's to protect us from foreign invaders. And sometimes it doesn't do its job. Primarily probably because of the Western diet that we have going on. And so it just weakens our immune system in general. It also is like a lymphatic, it's part of the lymphatic system. So there are top 5 reasons, I'm sure there's more, but top 5 reasons as to why this could happen. They may get inflamed is, typical virus or bacteria. Another one is the foods that we're eating, specifically a high refined carbohydrate diet is one. And another one is too much use of antibiotics. And another one is, too much use of antibiotics, food allergies. So B, you were just asking about food allergies. That is absolutely another one because it sees it as a foreign invader. And so, yes, that could be another one. And then another one that we might not think about, but which is oral sex. So oral intimacy, that also can introduce foreign invaders to the throat area. And that can cause some problems. So in naturopathic practices, besides the use of homeopathy, which could be very effective, is perhaps using castor oil packs. So you can put it over the throat area, and that can be very soothing. Castor oil, like I always say, penetrates really deeply. I would start off with 1 hour at a time, putting castor oil on a piece of organic cotton or wool and put it over maybe at nighttime. You can also make a tincture, a strong brew, of mullein leaf. And that is very, very soothing. Also drinking mullein leaf tea is very soothing for the throat. Olive leaf is another one. And that one is very great for antiviral properties. So Epstein-Barr virus could be a common one that causes the tonsils to inflame. And so olive leaf to the back of the throat, getting it all over the tonsils can be very, very helpful and soothing. There's a particular product that I like called Barlean's, and that one has peppermint in it. And that can be very cooling as well on the throat. And another one is black seed oil. It doesn't taste great. It actually tastes terrible, but it's very potent. And these are some naturopathic options that you can consider in addition to your homeopathic practices. So hopefully that is helpful for you guys. And thank you so much, Dr. Ibrahim, for having me on today. If there's any questions, if not, we will finish the webinar for today.
Hava, could you, you said castor oil pack, mullein tea, olive leaf tincture, and I didn't get the 4th and 5th one. I got
Leaf, and I believe I said black seed oil. Black seed oil.
Black seed oil.
Yeah.
Okay.
Okay, another one.
And what was the last one?
That was the last one. Let me see what I missed in between.
Oh, something you said tasted awful.
Yeah, black seed oil. Black seed oil.
Is that the one that tastes terrible?
Yes, it tastes.
Is that right?
Yeah. Yeah.
Okay, so that one. All right.
You're saying flaxseed,
So what I didn't get
F-L-A-X?
No, black, like the color black seed oil.
Ah, okay.
It's the Nigella seed.
So what was the number 4, the 4th one that you said had peppermint was the only word I caught.
Oh, but no, it was on the olive leaf. It's a brand that I like called Barlean's, BALEANS. and it's olive leaf extract, and it has peppermint in it, and it's very
Ah,
sweet to the throat. Like it feels very good. Oh, I do have another one for you guys. Cayenne pepper. Cayenne is a hot spice, right? So it brings heat to the area, which causes the immune system to actually recognize that something's there and bring those fighter cells to the area to do its job. So cayenne pepper also, maybe you could sprinkle it in some honey and put it down the throat, and that will help the area for the immune system to do its job.
thank you.
Hi. Can we use the tincture or the tea to do a bit of gargle for the tonsils? Few
Sure.
times a day, maybe?
Sure, like the mullein leaf tea. Yeah, absolutely. And if you don't have the tea and you have the tincture, you could put it in water, like distilled water tea and or spring water if you have, and then just gargle it as well. That can be helpful. Actually, also something else that I know sounds funny, but a little bit of energy work, just with intention, bringing your hands to your throat and just placing it there, closing your eyes, asking, I believe in God. So wherever your source of energy, spirituality is coming from, you ask for healing, just over your throat, just keep it there. You're asking your body, your immune system to activate itself, turn on those cells. It's time to heal. It's time for the inflammation to come down. And I have gotten actually rid of low-level bacterial infections doing that. So sometimes the immune system doesn't recognize it, and thinking it and, asking your body to help itself can, all the cells communicate. Our thoughts, even if we don't say it out loud, our thoughts in our brain communicates to our cells all day long. So that is also another tool. It's so simple that you could just, put your hands there and, ask, God or your body to do its work. And that can be really soothing and helpful, and also a great form of meditation for yourself and to connect to your body and see what it needs.
Thank you. Thank you.
So anyone have a question about this topic?
Dr. Imran, I had some tonsillitis when I was in holiday for about 2 weeks, but I didn't have any homeopathic treatment with me. Okay, in a case of tonsillitis, how long should we use them? Only like in normal homeopathy until the symptoms that we notice that the homeopathic remedies start to work, or I don't know.
So in acute case, homeopathic remedies start to work within a 1 minute, and if case is chronic, then remedies take time to work. So for example, if you suddenly feel pain in your throat and you feel your tonsils is swelling or enlarged, then we are use belladonna, baptasia, and pretacar. Mix together these three remedies and use in warm water every half hour one dose, and within a few hours you feel these remedies is work and your pain is gone and you feel better.
Thank you. Thank you.
Welcome. So anyone have another question?
Yes, hello, Dr. Imran. I have a question. If the tonsillitis are linked with earache, like my son he had the tonsillitis, and the doctor said it's allergic, and but then it caused severe ear pain, and he had also pus behind his ears. So what should we add to to help with pain and to help clear this pus behind the ears. I mean, tonsillitis coupled with ear pain and pus behind the drum, do you call it? I don't know. Thank you.
Okay. For ear pain and ear infection, we need to add Pulsatilla nigra 200C and Belladonna 200C. Mix together these two remedies and use 3 times a day, and Heper Sulf 200C 3 times a day. Pulsatilla and Belladonna 200C mix together and use 3 times a day, and Heper Sulf 200C separately take 3 times a day, and Bretacarb and Bacteria 30C mix together and use 3 times a day for enlarged tonsils. Pulsatilla and Belladonna for pain, and Heper Sulf 200C for pus.
Thank you. This is for the acute case, and to prevent this from happening, does psorinium, the one you mentioned, is that the one
Yes,
for prevention?
okay. Okay, sorry. Serenium, if bad smell, then we add Serenium 200C. So this protocol for acute and chronic case also.
Thank you very much. Thank you for all the information.
Okay, okay, welcome. So anyone have another question? Okay, I want to say thanks to everyone. Next Sunday, we meet again here, same time with different topic. So God bless you all. Have a good day.
Thank you, Dr. Imran.
Okay, welcome.
Thank you again so much.
Always welcome.